Before we start, Sister Rosamond, that's not an extremely common name. Are you related to Scott and Susan anyway? Was your husband anyway?
Where do they live?
Spring, Texas.
I imagine we are, because there aren't very many of us. Like there's under 2,000 of us, but I don't know them. And I don't think he knows them either.
We know them though. We lived in Spring, Texas, and so we were in their award with them many years ago. They're in the Woodlands now.
Oh, they're in the Woodlands?
Yeah.
Scott's dad is the one who baptized me. I'm a convert.
Oh, really?
Scott was my best friend in high school. One of my only friends.
Wow. Well, that's awesome. Yeah, he was a bishop of our ward before we got there, but we were in Spring for quite a while with them.
Oh, wow. What a small world.
Yeah. We're not in Spring, Texas anymore. We're in Buenos Aires, which isn't really close.
They're in Woodlands?
They're in the Woodlands, yeah, just north of Spring.
Right.
They are about as good a people as they come.
I guess we can't.
One more note, Dr. Kellis, you need to enable screen sharing for participants. I tried to do a quick share screen and it won't share. It's in settings somewhere.
Yeah, it should be on now. Could you check again?
Okay, I'll just do a quick screen share. Yep, looks like I'm on. Okay, looks like we're good.
Dr. Kellis is traveling today and can't guarantee the quality of his Wi-Fi connection the whole time. So he's asked that I go ahead and conduct our meeting today. We'll give everyone a few more minutes to see if we can get some other participants. Okay, again, for those of you who are just joining us, Dr. Kellis is traveling today. And so he can't guarantee the quality of his Wi-Fi. He asked that I go ahead and conduct our meeting today. And then Brother Black will be doing the Spanish translation for me.
Okay, vamos a comenzar la reunión. El doctor Kellis está de viaje, así que la hermana Black va a dirigir la reunión hoy.
Okay, perfect. Let's go ahead and get started with an opening prayer. Hermana Ingersoll, would you mind saying that for us, please? Hermana Ingersoll, you're on mute. I'm sorry.
Sorry. Our dear Heavenly Father, we're so thankful for this day, for the opportunity we have to meet together in this health council, and help us that we'll be able to learn and feel thy spirit and feel the ways that we can support and help and love the missionaries that we serve. And we're grateful for the specialists and experts that we have to support us and give us their advice and counsel. And we're grateful for this opportunity that we have to serve. And we ask these blessings in the name of Jesus Christ. Amen.
Amen. Do you want me to?
Thank you, Hermana Ingersoll. Before we get started too, I just wanted to take a chance to thank all of you. I know a lot of the people who are joining are some of the, the group of the health team, but so many of you who serve as the person responsible for health. Apparently, Sister Hermana Bond has a special helper today with her as the cat just walked across the screen. But we just want to personally thank all of you who serve in this capacity to help the missionaries in your area. I always say there's a special place in heaven for mission leaders one day, that you get extra wallpaper selections, paint selections, all sorts of things for the consecrated service you give. So we just want to thank you. We recognize the tremendous sacrifice it is to be away from your families for 3 years and to serve these wonderful missionaries, and just wanted to start by thanking you. Joining us today.
Voy a traducir eso. Voy a resumir lo que dijo ella para decir a los líderes de las misiones que ustedes van a tener un lugar bien especial después de esta vida allá en el reino de nuestro Padre Celestial, con una casa enorme y todo lo que merecen a través de su servicio aquí en la misión.
Yeah. Okay, thank you. So today we have a doctor with us, Dr. Bean, joining from Utah, who's going to be talking about some of the conditions that affect knees in the mission. And hopefully Brother Black can fill in some parts in Spanish, since Dr. Bean will be talking with us today in English. Okay, let's turn the screen over to you then, Dr. Bean.
Bueno, el doctor Bean nos viene de Utah, está aquí con nosotros hoy, y para que sepan, él no tenía el tiempo para hacer su presentación en español, así que vamos a hacerlo en inglés, pero si hay preguntas, se pueden hacerlas en español y yo puedo ayudar con la traducción, pero no vamos a tener el tiempo para hacer la presentación en inglés y también español, así que ojalá que puedan entender lo que está diciendo él.
Okay, perfect. Okay, so Dr. Bean.
Elder Blank, would you rather have me give longer phrases or shorter phrases? I didn't realize you're doing translation.
So what I mentioned was, because we hadn't planned on doing this, that you will go ahead and give your presentation. And if there are questions, if there are questions that arise in a presentation that will come in Spanish, then I will help translate at that point.
Okay, so you're not going to translate everything I'm saying.
No.
Okay.
Maybe you could at least try to do some summaries every now and then, Elder Black.
Okay. Well, Dr.
Yeah,
Nelson, tal vez sería mejor que usted lo hiciera. Maybe you should do it, since you're a doctor and you know the doctor vocabulary and I don't.
We'll try. I'm not
Or Matias.
I'm a lowly radiologist, interventional radiologist, so we'll see what we can.
My son is a neuroradiologist,
Oh, well, then that's good enough.
so we love radiologists. Okay, I'm going to do a screen share. See if that works. Did that work?
Sí.
Okay. Good morning. My name is Dr. Bean. I am a consultant to the Missionary Health Department, and I was an AMA in Florida from 14 to 16, and then I did an MLS live at home because I'm a convert and I didn't have a chance to do a mission when I was a little kid, so I had to do two as an adult to make up. Let me talk just a tiny bit about orthopedic principles. Who's translating? Elder Black, are you? Dr. Black, Elder Black? Why don't you break in when you want to say something?
Okay. Vamos a hablar en cuanto a algunos puntos básicos de problemas con huesos y cosas así.
Okay, for those of you who can hear me, we're just going to talk about soft tissue injuries, no fractures, nothing like that. There's way too much to talk about. And the one thing I wanted to say is orthopedic ligament injuries are graded 1, 2, and 3. 1 is minor, 2 is a half partial injury, and 3 is a complete injury.
Vamos a hablar en cuanto a tipos de heridas a los tendones. Hay 3 maneras y muy mal hasta leve problemas.
We have noticed, and I noticed when I was in AMA, that doctors in the field tend to overdiagnose. They want to scan everything. No offense to the radiologist. They undertreat. I've seen ACE wraps for horrible ankle injuries. They want to operate too soon and order too much physical therapy. So you do the opposite.
Quizás a veces en diferentes partes del mundo donde hay misiones, parece hay muchos deseos para hacer resonancia o TAC sobre 2 partes. También quizás a veces pueden hacer solamente una cosa leve para ayudar una herida, pero también está haciendo recomendaciones para muchos tiempos de kinesiólogo.
Okay, we're going to jump right to knees. I give this lecture to the outgoing AMAs every other month in the medical training for AMAs. I'm using the same slides because it should apply. We're going to take it from your approach. What happens from your end rather than just lecture about different things. So we're going to say, what happens when you get the phone call?
¿Qué pasa cuando recibe esta llamada de teléfono?
Elder Bean, my knee hurts. It kills me when I ride a bike, go up the stairs, kneel and squat. I did not injure it. And if you poke on it, it hurts on either side. What's wrong?
Hay dolor en mi rodilla, no tenía accidente, pero me duele cuando estoy andando, usando una bicicleta, cuando está de pie o cuando estoy de rodillas. ¿Qué pasa? No tenía problema.
Who has an idea what's wrong with this poor sister missionary? Anybody? Nobody? Nobody wants to venture forth. Okay. 5 seconds. It's kneecap. It's patellofemoral disease. Translator.
Es problemas con la rodilla en cuanto a la patella. Is there another name for that, Elder Kellis? Patella?
It's rotula.
Rotula, okay. Problemas con el rotula y el rodilla.
It's a little complicated, but what happens is the kneecap can wear out or become damaged because it gets too much pressure on it.
tiene problemas con rótula, que tiene mucha presión y puede tener daño a esta parte.
Or it sits crooked in the groove right there. See how it's crooked?
El lineamiento es no correcto y puede tener un dolor a causa de eso.
The joint surface should be nice and smooth like that. It gets worn and frayed like that. Called chondromalacia.
Entonces, la parte que está junto a rodilla puede tener cosas mal con la chondromalacia.
The x-rays can either be normal or they can show the kneecap is crooked. See how that's sitting way off to the side? See how these are sitting way to the side?
Puede ver la rótula no está en el lugar donde necesita estar, pero está saliendo a la parte lateral.
What makes it hurt worse is anything that you are doing with your knee bent, like going up and down stairs, riding a bike, doing squats, deep knee bends.
Siempre tiene dolor cuando su rodilla es doblado, como bicicleta, caminando arriba escalas, algo así.
So we avoid those things.
Debe no hacer estas cosas.
None of this, maybe none of that. We treating it with exercises, anti-inflammatory pills, a knee brace, and maybe we limit biking.
Para tratar eso, usamos pastillas de antiinflamatorios. Puede usar ejercicios para hacer mejor los músculos. And Dana, what's the word for brace, knee brace?
Rodillera.
Rodillera.
Anybody have any question on kneecap?
Hay preguntas en cuanto a rótula y rodillas.
I'll just ask you one, Dr. Bean. No missions in our area use bikes, but missionaries walk an average of 10 miles a day in every mission in our area. So what's your recommendation for these mission leaders about adjusting the schedule?
Because you're not walking is not something that really badly damages kneecaps, you're probably okay. Don't go up and down stairs and don't do stairs for exercise.
No debe subir escalas a menos que es necesario y por supuesto no hace ejercicios con eso.
And it takes about 10 days to 2 weeks for the anti-inflammatories to work.
Casi 2 semanas para las pastillas para ayudar.
Okay, let's go on to something else. Here's the story. Dr. B, my knee hurts. I was running and I twisted my knee playing soccer. It hurts to walk on it. It swole up 24 hours later. It pops, but it doesn't feel wobbly. If I twist it, it really kills me. So what's wrong with this elder?
Dana, I'm going to let you do the next section. We'll alternate.
Yeah, I'm in a McDonald's. It's a madhouse here. I can hardly hear myself think. I'm sorry.
Okay. Parece tiene dolor cuando está corriendo y hacer
What do you mean by throat spray?
movimiento a la parte lateral y no es mi rodilla es estable, pero ¿qué pasa? Lo siento para mi traducción.
Does anyone have any idea what's wrong with this elder? Soccer.
¿Qué
I
pasa?
would I would suggest probably a knee sprain as opposed to torn ligament since it's not wobbly.
Yes, close, but what kind of knee sprain? What exactly did he do? But you're exactly right. This does not sound like a ligament injury. It's a torn medial meniscus, this little cushiony thing here. You don't need, that's alcohol.
Rompió su menisco. Menisco.
Meniscus. Okay, the meniscus is a little cushion that sits in between the two halves of the knee joint. It has a bad blood supply. The blood supply is only this outer 1/3 or 1/4. In here, there's no blood supply. And the key is that if you tear it in here, it won't heal.
Si rompió esta parte de rodilla, no hay nada que puede sanarlo. Su cuerpo no puede sanarlo porque no hay sangre por dentro de esa parte.
It can tear in many ways, like you see in this picture.
Hay muchas maneras en que puede ser rompido.
If you tear it like this one, it can lock the knee up and you can't straighten it out. It's called a bucket handle tear.
No puede ver dónde está por aquí. Si tiene este tipo de rompido de su meniscos, puede hacerlo para que su rodilla no funciona.
You don't need to translate this. I'm just going to apologize to everybody. My doctor started me on lisinopril for my blood pressure, and that stuff gives you a terrible cough. I've got to talk to him this week. What do you do to work it up? Probably x-rays, probably not an MRI scan.
Solamente necesito resonancia si piensa que hay otras cosas.
You treat it similar to the kneecap. You treat it with anti-inflammatory agents, exercises, a knee brace. And if it does, and give it about 6 weeks to get better.
Generalmente 6 semanas para ser mejor con todo lo mismo que hemos dicho, antiinflamatorios, rotula y ejercicios.
In 6 weeks.
If they don't get better, then you can do an arthroscopy and trim the meniscus out.
Si no está mejorando, puede hacer una escopia para cortar esa parte que está rompido.
Here's how to do the exercises. You tighten your muscle and then relax. You do that 20 or 30 times every 2 hours. And then you lift your leg, hold it for 5 seconds and relax and do that 3 or 4 times a day with or without weights.
Ejercicios para hacer mejor los músculos.
We ready to go on?
Yes.
Okay, the third thing I want to talk about is this, the ligaments. Here's the story. Dr. Bean, I was playing football. Somebody hit me from the side. My knee became swollen immediately. I can't walk. It gives way when I walk. My comp says the knee is swollen bad, and if he grabs it, it feels wobbly. Okay, what's wrong with this guy?
Él tiene dolor, pero también su rodilla es estable y siempre hay dolor cuando mueve su rodilla un lado o el otro. ¿Qué piensa es el problema?
Okay, who can guess?
Torn ACL.
Pretty close, probably. Could be MCL, ACL, or both. But you're right. That's exactly how you tear your ACL. Get hit from the side, the knee buckles sideways. The key is it feels wobbly and it swells up immediately because it's bleeding.
Hay ligamentos rotos, siempre empieza a hacer más hinchar porque está sangreando por adentro.
There are 4 main ligaments inside the knee. There's one on the inside and one on the outside called the collateral ligaments. There's the ACL in the middle, and there's the PCL in the middle too. The PCL we don't injure much, so we worry most about these 3.
Hay ligamentos laterales y cruciante que son más importantes los que estamos preocupados en cuanto.
When the knee is hit, it tears the ligament on the outside and it tears the ACL frequently. The tear can be a partial or complete. Partial or complete.
Ligamentos rotos pueden ser completos o parcial, dependiente en tipo de accidente.
Sometimes if you tear the ACL partially, it will go on to tear completely later.
A veces no puede ser roto total, pero con tiempo sí va a ser completo.
If you think you have an ACL tear, you probably ought to get an MRI scan.
Si tiene problemas con ligamentos, necesita resonancia.
Because if they have an ACL, you're going to send them home.
Si tiene problemas con el cruciate ligamentos, ellos necesitan ir a la casa para cirugía.
The treatment, if it's a minor injury, is a long brace for 3 weeks to 6 weeks, and then a short brace. They don't have to go home if the ACL is intact.
Si no es un ligamento roto completo, puede usar rótulas para ayudarle primeramente larga y después más corto.
There is some controversy about whether or not you ought to fix everyone with an ACL injury. Tell them that.
A veces no es necesario, o bueno, hay diferentes de opiniones en cuanto a necesita sanar todos estos problemas.
Most of them get fixed, and we never do it in field.
La mayoría de ligamentos rotos ser necesita cirugía, pero nunca hacemos en la misión, siempre ir a la casa.
One note, we usually delay 3 weeks before we fix them, because if you fix them too soon, the knee tends to freeze up.
Generalmente esperamos 3 semanas antes de la cirugía para resolver ese problema.
You can do an ACL reconstruction months or years later.
También puede hacer una reconstrucción algunos meses y también años después si tiene problemas.
The way a reconstruction is done is you cut a chunk of patellar tendon out with bone on both ends. Then you slide it in place and lock it down with 2 screws. You can also use a semitendinosus graft and put the graft up in here without a bone fragment on it and tie it over a screw or a post.
Él está mostrando diferentes maneras que puede hacer la cirugía para corregir el ligamento roto.
Yeah, we'll skip this down the bottom.
Yeah, and Dr. Bean, if I could just give you a
Yes.
heads up, we have at 1:30, we're going to transition over to the mental health topic. So if there is any, would you mind if any of the hermanas could ask you questions, since most of the people on this meeting are the mission leader spouses who handle the health? Would you mind taking some questions about what they can do for knee injuries? Or to
No, not at
prevent
all.
knee injuries?
I'm one slide from being done, actually.
Oh, okay, perfect. That'll be
No,
great.
we're
Just kinda
good.
want
I
you to-
anticipated we'd want to do a few questions. So here's
Okay.
how to do the exercises. And then here's the official statement. MRI can be helpful with an ACL tear, blah, blah, blah. Okay, I am open for questions.
Preguntas si tienen.
I have a question. Sorry, I'm not raising my hand. Sister Rosenlund, on the meniscus tear, so often, how long should the missionary rest, or can they work with the meniscus tear?
Depends on how much this bothers them. They can work after, you usually want to give them a couple of 2 or 3 days off, put them on crutches 2 or 3 days to let the knee kind of calm down. And if it's not too bad, they can walk to the limit of their ability. They probably won't be able to go 10 miles. But they can walk some and then rest a little bit. Then the next week, walk more and rest a little bit. The only cause for immediate surgery is if the if the knee locks up because it's got a bucket handle tear. Those you have to scope immediately. Well, within a few days. No big deal. They can go home.
Okay. Él dice que tiene un roto meniscus. Puede trabajar después de 2-3 días de reposo y pueden andar hasta el punto que no puede. Pero quizás con tiempo puede hacer más cada semana y con algunos días de reposo de vez en cuando. Any other questions? ¿Más preguntas?
All right. Well, thank you so much, Dr. Bean, for being with us.
How do I stop screen share? There it is.
Okay, perfect. We appreciate you coming, and for the consultation piece, you serve as well for our AMAs, that they can ask you a lot of questions. Hermanas, when you have knee injuries, which we get plenty because missionaries love to play football on Mondays, we get plenty of knee injuries in South America. Just check in with Dr. Kellis and Dr. Nelson, and if they have questions above that, then Dr. Bean is the type of consultant they call for that. So thank you again for joining us, Dr. Bean. Okay, we're at this time, we appreciate it. We're going to turn the time over to Elder Simons to talk a little bit about PTSD. You guys have been at this job long enough to know that your missionaries are going to experience a few things that are unusual for them, whether that's being robbed, wounded in a robbery, experiencing some degree of sexual assault, being put in compromising situations, even with companions. And when that kind of trauma occurs, they'll often be referred to one of us to help them process that experience. So Elder Simons is a PTSD expert, and he's going to share with us now some information on treating PTSD in the field.
Vamos a dar el tiempo a Elder Simons, quien es uno de nuestros psicólogos, que él es experto en TEPT, el trastorno de estrés postraumático, y vamos a tratar de hacer algo diferente durante su presentación. Ellos van a utilizar los subtítulos durante la presentación, así que va a traducirlo automáticamente. Y ojalá que lo haga bien y vamos a seguir entonces. Go ahead, Elder Simons.
Elder Simons, you might still be on mute.
Yes, trying to find the button there.
There we go.
So this should have a Spanish interpretation at the top. So maybe,
I'm sorry, give us 1 minute. It's not open in the right program. And so it's not going to show the translation.
Hermanos, while he pulls that up, do any of you have questions about when would be a good time to refer a missionary if you're concerned about their response to some sort of traumatic incident? And if you, I can't see everybody's screen here, so if you have a question, feel free to just, open up your mute and ask a question. Any of you have any questions about when, Sister Alleman? I think I saw you waving.
Yes,
Hermana
thank
Alleman.
you. I am wondering, is it possible for a missionary to have post-traumatic stress if they've had like a really tough companion?
Yes, for sure. Yeah. Just it can happen in a small setting. So if we learn about it quickly, it usually, like if the missionary hasn't opened up to you for a while and they've been with them longer than a transfer or something, then we often I always say about the same amount of time they spent with that companion is amount of time it takes for the trauma response to resolve. And so we try and work with them, building some skills on that. But yeah, a difficult companion, even sometimes what they hear from investigators, right? They will hear about life situations and things like that they've never heard about before, and that can be traumatic for them as well.
Okay, Simon, are you ready?
Looks like they're still working on some of that.
Así que la pregunta fue ¿es posible tener este trastorno de estrés postraumático al tener un compañerismo que es muy malo? Así que al tener una experiencia muy mala con sus compañeros. Y la hermana Black dice que sí es posible, de verdad es posible, y muchas veces cuesta el mismo tiempo que tenían en el compañerismo al tratar el trastorno.
Okay, can you hear me?
We can hear you. Yep.
Okay, just a little introduction. My name is Elder Simons, and I'm here with my wife on a mission. Both of us are AMHAs. And I'm recently, a couple of years, retired from the military as a mental health clinical social worker. And just one of the first points I wanted to make is the fact that we're all subject to facing mental health challenges and concerns throughout our life. One of my favorite quotes from Elder Irene is that over half the people that you meet on a given day sorry.
Give us 1 second.
Now it's on there. Okay, sorry about that. Technically challenged here, but over half the people that we meet on a given day are experiencing some kind of serious life challenge. And that's always resonating with me. And I've shared that with a lot of my clients. Some mental health facts or quotes that, and more particularly related to PTSD. In the US, about half of the people that we encounter on a given day, half the people experience a mental health problem in their lifetime. When you look at your missions, you have, I'm guessing, around 150 to 170, if that's...
The subtitles aren't showing. Give me 1 second.
Okay. Can you... It's in English, though. All right. See if that worked. Anyway, if you have a mission of about 150 missionaries, typically you're going to have about 8 of those that have a mental health condition. And out of those 8, 4 will actually report that. One thing that we know about mental health and PTSD especially is that often there is a co-occurring disorders that we experience. 80% or most people with PTSD suffer from some other kind of mental health disorder. So I think that's important to understand. And with our young adult population, about 3/4 will manifest some type of mental illness if they're prone to that by age 24. So I think that's why you can see a lot of mental health issues manifest when they come out on their mission. So what is post-traumatic stress? So it's a mental disorder that can develop after a person of any age experiences a traumatic event. Could be all kinds of different traumatic events, exposure to one, or actually experiencing one. And the risk factors include exposure as the big one, I would say, for PTSD, having trauma in your childhood, having another mental health condition, family members with mental health conditions, as far as in the military, exposure to combat or deployment to a war zone. I think another really important one that doesn't get emphasized enough is lacking social support. So what are the symptoms of PTSD? They can include flashbacks or reliving the event, although this is pretty rare. Difficulty sleeping. Avoidance is a big part of PTSD, avoiding the thoughts, feelings. And that's something that can cause people to get stuck in their symptoms when they engage in this avoiding behavior. So that's something I teach the elders and sisters when they have had a traumatic event, such as a robbery or something like that. Negative thoughts about oneself, distorted feelings, guilt and blame are big ones. And these symptoms can usually begin within about 3 months of a traumatic event, but they can also show up years later. So that's important to understand. And they will persist for at least a month. We all have post-traumatic stress, or most of us do, when we've had a traumatic event. Post-traumatic stress disorder is when those symptoms persist after that month. And again, like I said before, a lot of times it's because we engage in behaviors that cause those symptoms to get stronger and become more entrenched. And that usually is about avoidance when it comes to the thoughts, the images, places and people, those kind of things. So we try to encourage our elders and sisters to, in a sense, get back on the horse and do the things in a safe way, of course, to help that recovery period. In 2011, I was active in the Air Force at that time doing a PTSD fellowship, and I was asked to do a report for Congress on PTSD. And so we were looking at PTSD diagnoses from 2003 to 2011. And not surprisingly, we saw a huge increase in PTSD over that period of time. One thing we do know is that mental health problems are rising worldwide with our young adults, especially since 2012, and adolescents, I would say. I was going to throw that out there. Why do you think that is? We've had this huge spike since 2012 as far as mental health problems. Any thoughts on that? And the clue is going to be in the next slide.
I would say it might have something to do with the increase in social media.
There you go. Go to the next slide. There's the phone, it pops up there. I don't know that we can definitively say this is the case, but I think there's a lot of evidence to support that. But most of us will experience what can be described as some kind of trauma at some point in our lives. Important to note that despite this, most of us will not develop PTSD. It's about 7 to 15% when we've been exposed to a trauma. There are some traumas that you see PTSD more likely to happen. Sexual assault, men on men, and being a prisoner of war, those type of things. Sometimes we make the assumption that because someone experiences trauma, they need a mental health intervention of some kind. When I was in Iraq, we had 4 soldiers, one of them from Utah, that were killed, and their bodies were brought into the hospital, and we got a call that we needed to get to the hospital ASAP to help these providers who were upset and crying and showing just some normal emotions. And one of the things we did, and I've had to do in many cases, is just to educate that there are normal responses to these abnormal events. A wise approach would be to reach out to someone that we know that has experienced a trauma and offer help or offer to give them some education. Sometimes that's not right after it happens. One thing I learned as a first responder in the military is when you try and force a therapeutic intervention on a person, that can cause more problems down the road and make it worse. Mental health disorders, including PTSD, they're about functioning in our work, our school, our relationships, and are more likely to occur when we don't have or choose not to use healthy coping mechanisms. And one of those I'd like to spend a few minutes on is faith as a healthy coping mechanism. And I want to read a couple of quotes here. One of them is, "I have discovered with few exceptions that scholarly research generally supports the conclusion that religious belief, and most especially personal religious devotion, contributes to mental health, marital strength, and family stability. We also know that addressing emotional and mental well-being require both faith and reason. For example, some individuals respond to the threat of sickness by thinking and saying things like, 'We do not need to take precautions to protect ourselves from sickness or injury. God will protect us.'" So there's a more balanced approach I think we can take to that. Elder George Albert Smith had some serious physical problems early in his call as an apostle, and he was also suffering from some depression at the time. And he was 33 when he was called to be an apostle, and then served as president of the church when he was 75 and died at age 81. But one of his uncles wrote him a letter, and I thought this was pretty interesting. He said, and this is at a time when Elder Smith was doing a lot more than he probably should have been, and not delegating, and just had so much weight on his shoulders, and was suffering from some of the effects of that. He said, "For heaven's sake, George, sidestep or step backward, not forward." This is the letter. "Cheat the asylum of a victim. Dump your responsibility for a while before the hearse dumps your bones. Once more, I will make the plea. If you are doing all this for humanity, stay with humanity as long as you can, and administer the medicine in broken doses. If the church requires your life, give it to the church in a thinner layer, spread over 30 or 40 more years instead of 3 to 5. Could you not do more good in this way?" And then another quote from this letter. "Now, George, wake up. We can't afford to lose you. Give the other fellows an inning while you drink lemonade in the shade. Call Casey to the bat, and you will watch the game while the others run the bases for a while, or you'll be hauled off in the ambulance before the game is half over." So I think there's some things we can take away from that as far as doing things in wisdom and order. And I think as leaders, that's something that we need to think about, taking care of ourselves. I love this quote: "Almost everything we will work again if you unplug it for a few minutes, even you. And the best time to relax and take a break is when you don't have time for it." Some of the examples from Elder Smith is about chronic stress or running faster than we have strength. And, PTSD is also having that fight or flight constantly activated, being on guard day and night. Our bodies aren't designed that way. And I think there's some things that we can learn about taking care of ourselves and allowing our bodies and our minds to heal when we've had traumatic experiences. And some of these lessons we learned from President Smith's experiences with depression or chronic stress, and which also can apply with someone suffering from PTSD. And the first one is individuals who have faith in God and earnestly strive to keep his commandments can experience depression. And I would add trauma to that. And personal righteousness in and of itself doesn't always prevent or cure mental and emotional suffering. And number two, we see that our mental and emotional impairment is often found in association with serious chronic physical illness. And you can look at some of those. These are studies that have shown a strong correlation in PTSD and the following physical ailments that are on there. And number three, these mental and emotional impairments to greater or lesser degree may be a burden with which some people are afflicted for the duration of their mortal lives. And four, these impairments don't necessarily prevent a person from accomplishing his or her life's mission and from living a meaningful and rewarding life. However, there are effective ways to help us lift us and some of that burden if we will just accept the help. And lastly, they can be an experience God allows for us, the qualification, purification of those who suffer. So how can we help people? And I'm not sure where I'm at on time, so just stop me if I'm going too long. When we trying to help those who have mental health challenges, especially trauma, a lot of mental health concerns and challenges are about perspective. Any mental health disorder, including PTSD, is about how we mentally and emotionally process things. It's a matter of perspective. And that perspective can be helped by another human being caring about us and helping us. And one of the most helpful ways we can help someone struggling to find perspective can happen through talking or even just physically being present with that person. There's this concept of psychological error and seeking to understand first and asking questions and validating their experience. And that's really what therapy is about. But you don't have to be a therapist to practice seeking to understand and validating someone else's pain. And one of the reasons our greatest generation suffered so much from trauma from the Second World War was, and this is from the United States and other countries, was because they didn't understand the importance of sharing that burden. Instead, they refused to talk about their pain and they suffered in silence. And they were often enabled in that approach to hide and isolate and avoid, which made things worse. And what I've learned is that healing is about sharing our burden, normalizing the experience, using our life experiences to grow. It's about feeling heard and knowing that we're safe, which are all a part of putting meaning to an abnormal event, especially with regard to trauma. So if a missionary or family member or friend shares with you that he or she is trying to manage a traumatic event, what are some things we can say or not say? I mean, some things you don't want to say is just move on already, suck it up, get over it, calm down. Those don't work because they invalidate that person's experience. They convey that their feeling is wrong. Tell them that their reaction needs to stop. What might be more helpful is, I hear you. That sounds really hard. That's tough. I'm here for you. I'll help you through this. And again, it's important just to be that listening ear before seeking to give advice. Just get curious. Tell me more. Help me understand. Let's talk. And listening with love. And this is a quote I like. I don't know if it's going to pop up here, but this is from Sister Alberto from one of the conference addresses, the second counselor in the Relief Society. She said, listening with love is one of the greatest gifts we can offer. And we may be able to help carry or lift the heavy clouds that suffocate our loved ones and friends, so that through our love, they can once again feel the Holy Ghost and perceive the light that emanates from Jesus Christ. One of the things that I had read and learned about, there was an African tribe in I'm not sure what part of Africa, but when there's somebody in the tribe that does something wrong, they'll get that person and bring them to a certain point, and they will all surround them, and then they will say good things to them. That's how they manage when somebody does something that's not appropriate. I don't know that I have a whole lot of time, so I want to just kind of summarize here the post-traumatic growth. That's the best part. When you've experienced a trauma, if you can turn that into post-traumatic growth. And that is about being able to look at these experiences in our life and seeing them from a perspective of, okay, how has this helped me? I know there's things that have happened to me personally since I've been on my mission and throughout my life that when they happen, I'm like, oh man, I don't want to go through this. But now that I have perspective and being able to look back, that I've seen some good things, and looking for the good and teaching our missionaries to look for the good in difficult and what they might see as bad situations. You know, what's great about this is what I like to teach my missionaries when they're struggling, and that's hard to see, but we can do that. And they can do that with if they have this approach. And what do they learn from this experience? That's one of the things that I've heard that can help these missionaries who are struggling to get through some very significant adversity. If they will turn their brain to that question, what can I learn from this? It refocuses them and helps them to take them out of that victim mode. And then
Perfect. And do you mind if we see if any of them have questions for you? We don't want to, a lot of them have to leave right at 2:00. And you're our expert.
Okay.
Hermanos, do any of you have questions for, I always want to call him Dr. Simons, but Elder Simons. I don't have any questions. Elder Simons, anything they should be watching for, right? If they have some of our missions, if they have a robbery, especially a robbery with a weapon or something like that, they have us talk to those missionaries within, the next day or so or whatever. Other missions, we don't get any referrals from traumatic incidences. So what would you say they should be watching for to see if a missionary needs extra help?
I would say that, just talking to them, you're going to be able to see how they're affected by it. You're going to be able to see their emotion, how they appear to you, how they tell you the story. If they complain about any concerns, or you hear of a companion that complains about any concerns with them sleeping or not wanting to do the missionary work, not wanting to leave the house, things like that. Those are things I would advise.
Right. Hermanos, any questions, specific questions for Elder Simons? Okay. Did you have a final comment there, Ed, that I cut you off from?
No, I'll just finish it up to say that, teaching our missionaries that it's, if they have a good miserable day once in a while or several in a row, just stand steady and face them. Things are going to straighten out. There's great purpose and struggle in life. So that's the post-traumatic growth part. And I'll just finish with this quote. This is also from Sister Roberto. She said, "Your struggles do not define you, but they can refine you. Because of a thorn in the flesh, you may have the ability to feel more compassion toward others. As guided by the Holy Ghost, share your story in order to succor the weak, lift up the hands which hang down, and strengthen the feeble knees."
Perfect. All right. Thank you so much, Elder Simons. That was great. And we appreciate your expertise in this area and what it's added to our area by having you here. If I could just add a quick thought, right? If you ever, like he said, have a concern about a missionary, like he said, you get their phone call, you get a little concerned, then to just pass them on to one of us, and then we'll let you go from there. Looks like Hermana Doxy, you have a question? Go ahead.
Yeah, you mentioned that sometimes it's better to wait a little bit after an event before getting help.
Yeah, I would say
that?
And then what we learned in the military is that within a couple of days, then we talk to the persons and say, "Hey, how are you doing?" And a lot of times that's when some of those symptoms will show up that we're concerned about. That may not always be a hard and fast rule for that, but that's the way we approached it. Yeah.
Okay, because sometimes it will just kind of resolve. It's just a normal reaction, and then you wait to see if it's lingering.
Yeah, anytime there's a robbery, I would still just check in and see. And it wouldn't be a bad thing just to let us know so we could also check in with them.
Okay, thank you.
Anyone else? If I miss your hand, you're free to just start talking. One thing I always tell missionaries when I've worked with them, because often when there's been some sort of incident involved, a companionship, is that it would be really great if we could pick our body's response to it, but we do not get to pick. So for some
Mhm.
people, it may be a strong fight instinct, some a strong, I mean, I've had a missionary almost kill the person who jumped them and they've never injured another person in their life. Just we don't know what the response will be. And so kind of normalizing that response and giving them some tools to work through that response can be helpful. But I would say if you're at all concerned, send them our way before you just keep watching for weeks and weeks and see if it goes away. Just so we can help them earlier on, keeps it from escalating to being more complicated. So again, thank you so much, Elder Simons, and then Dr. Bean, who was with us earlier. Before we finish, any other questions before we conclude our meeting today? Anyone else? Okay. All right.
You're muted. You're muted. Oh, no, you're not.
Okay. All right. Well, let's go ahead.
Okay, all right, Sister Simon.
Oh, Wendy, did you have a question, Hermana Simons?
Yeah, can you have either your husband or somebody ask if the subtitles were helpful on our PowerPoint?
Los que hablan español, los subtítulos ayudan? ¿Ayudaron? Sí. Muy bien.
Okay.
Y me da sorpresa que son bastante buenos. Mejor que Google. Así que es una herramienta que está en PowerPoint que descubrimos hace algunas semanas. Pero es es una herramienta muy buena. Muy bien.
Perfect.
I also wondered, are you sharing this PowerPoint and will Dr. Bean share his with us to keep it?
We can do
We
that.
can, the
Yeah.
meeting's always recorded. And so we can pass that on, and then I think they can be emailed as well through the same email that we send out the invite to.
Dana oftentimes, Elder Kellis oftentimes shares them as well. Do you have a copy, Elder Kellis, of Dr. Bean's presentation?
Yeah, I'm sorry, I can't hear. It's too much noise in this place. I apologize.
Okay, we'll get the presentation sent around.
Perfect. All right. Welcome to the joy of serving in a foreign country. Nothing once perfectly on time, anytime. Right? We just do the best we can. All right. Well, let's go ahead and have a closing prayer. Hermione Jorgensen, would you mind giving us our closing prayer?
Querido Padre Celestial, te agradecemos por este día, y por nuestros llamamientos, servir en este país bonito. Y te agradecemos por todas las bendiciones que tenemos. Y por favor, bendícenos con tu espíritu y con sabiduría y todas las cosas que necesitan para servir nuestras misioneras. En el nombre de Jesucristo, amén.
Amen. All right. Thank you so much. See you next month.
Gracias por todo.
Thank you. Ciao.
You.